Hello, this is Dr. Stanley Lang. Welcome to this video, and this is about preventing heart disease. So if that's not something you want to know about, just skip the video. Otherwise, I want to tell you a story of 3 different heart patients that I saw on the same day, and it was such a dramatic difference that I thought it illustrated a good point. And the point is that there is a major and simple thing that we can do to dramatically decrease our risk of having heart disease. And so the first patient that I saw was unfortunately a follow-up from having had a heart attack. And he had had many years of encounters where he had definitely wanted to do something about his risk because he knew he was at risk because of how he was eating and being overweight. And we talked many times about how insulin resistance and metabolic syndrome were a major risk factor for heart disease. But unfortunately, he just never was able to connect the dots and overcome the internal resistance that he had to make the changes. The second patient that I saw had a similar conversation, but he basically reached some point where he was able to touch a core desire inside that said, I'm going to do this. I'm going to use these simple tools. I'm going to reverse my risk. And in 4 months, he's lost 47 pounds. He looks great. He feels great. He reports that he's sleeping really well. He's thinking more clearly than he has, and he's now retired, and he can't remember a time that he's thought more clearly. And he was intending to follow the ketogenic diet, but he ended up just following a low glycemic plan that we teach. Now, the third patient is somebody that's kind of teetering. He's moving and he's trying to make some changes, but he backslides a lot, and he does what is very typical of many people, which is that we tend to self-defeating behavior. We tend to do that for 2 main reasons. Number one, we have a self-image that has sort of a pre-programming that says, I don't deserve to be well. Now, this is going on at a subconscious level, but it's there, and if you don't know why that's happening, you're not going to be able to disarm it. Second of all, chronic stress feeds all of this, and these 2 obstacles prevent people from doing what the second patient did, which is to finally take action with a tool that works and make a big change. So first of all, you need to understand what low glycemic eating is all about. And if you want to know what that is, please click on the link either on this video or below the video, and you can have access to that information. So I hope you do take action, because heart disease is still the leading cause of death for both men and women in the United States. So I wish you well and hopefully a new life. God bless, and have a great day.